there's another important study out this month, and it focuses on employee health and wellness programs. Conducted by Virgin HealthMiles, the study found 76% of employers reporting healthcare cost increases, and nearly 90% of American businesses are now relying on employee health and wellness to reduce their overall healthcare costs. Virgin HealthMiles provides wellness incentive programs to more than 120 companies, comprising more than 700,000 employees. Its Chief Executive Officer, Chris Boyce, joining us now in studio. Good afternoon, Chris.
Hi, Carol.
Hey, let's start with that McKinsey study, because that, to me, seems a little troubling. That's a big drop in terms of how many companies might drop their employee health plans. Much bigger number than what the president expected, what the Congressional Budget Office expected. Tell me what that means potentially for you.
So we think it's really interesting to see that could change. But for me, as I read the report, it feels like shuffling deck chairs, right? Whether I pick up my insurance through an insurer directly or whether I get it through my company is kind of interesting, but really getting at the core of the cost, which is our individual behaviors and what we do as individuals, right, is really where we think the big action is. 75% of the chronic disease today comes from comes from individual choices. So the driver for all of this cost is really what we choose to do as individuals. And so if we don't enact something that is like a good driver discount for health insurance, we're going to be in trouble, because it's our actions that are actually putting in this category.
But you work with companies to put in place these wellness programs. So my curiosity says to me, if they're going to stop doing employee-sponsored health programs, they're going to say, I don't need to do a wellness program either. I don't really care.
So that's interesting. The McKinsey study actually points out very specifically that while they may change the insurer component of it, that it is still going to be American companies that are front and center on the health and wellness side of this. They're the ones that want to take care of their employees from a productivity perspective. That's what the McKinsey study says. So if you're giving credence to the McKinsey study and it's shifting insurer, they still are saying health and wellness will come from the employer themselves.
Well, talk about the flow of business to you guys. I mean, do you have more and more companies who are coming to you and say, I want a wellness program? We have a wellness program here at Bloomberg. I know a lot of companies do. Talk to us, though, about that flow.
Yeah, so what happens today is, again, the study that we just released, 90% of those companies are saying we're relying on health and wellness to actually curb our health care costs. And we have clients today that are showing a flattened health care cost because of the implementation of our program.
So there's an impact. You see that?
Absolutely. Absolutely. We can actually track and see what people have done. So the tools that we give employers give them the ability to motivate their employees and then measure the outcomes of that and measure what actually changes and then differentiate the insurance premium, for example, based on that.
But Chris, help me out here. So again, if the McKinsey study found that a third of employers are likely to drop employee coverage, if they're not covering their employees, are they going to really care to still do wellness programs?
I think the answer is yes, because the McKinsey study definitely highlighted not just the 30% of employers, but the fact that some employees are going to be in and some employees are going to be out. And so they still want something that is going to cover all of their employees. We have many clients, international clients, where they don't cover the insurance of the people internationally, but they want the program for them as well. It's because it's part of the culture, it's part of the productivity, it's a part of what it is that they're trying to drive.
So there'll still be a need for it.
We absolutely think so.
Got to leave it on that note. Chris, thank you so much.
Thank you very much.
Thanks for coming in studio. Chris Boyce, the CEO of Virgin HealthMiles.